G'day, I'm Jedynak, and I just want to say thank you for being part of the biggest and best FMT training in history. And because of your involvement, I wanted to put together an extra bonus or give you some added value to help you get even better clinical results with your new FMT skills. I've been going through some of the feedback that we've been receiving, and I've got to say, it's just been amazing. Caitlin has written, I've not been as excited about my job in a long time. This course was actually life-changing. Thank you, Caitlin. We have the best CPD I've attended in years. Thank you. That's from Eve. Thank you, Eve. What about this? I've attended a lot of seminars in my career. This is by far the best. Well organised from start to finish. Terry, this is Terry, a chiropractor who came down from Malaysia to do our FMT training last weekend. Thank you, Terry. I love this one. Awesome event, great skills, fun environment, best CPD I've ever done. Thank you, Jessica. And Ted could be funnier. Okay. Next up, Ted needs help with his jokes. Is it supposed to be in there? Ted's jokes work best when they're in the right place. The bin. All right, so yes, as you see, we've got a variety of feedback here. The missing piece of the puzzle is missing no longer. Love that. Anonymous, all right. But great summary of what my aim was certainly for the workshop for you. Okay, so one of the things that we've been that's been highlighted with the feedback is the role of exercises. What do you do with the exercises? What exercises do you apply? When do you apply them? How does that all work? So I've put together this video to specifically walk you through the exercise plan that will help you get better clinical results with your FMT training and with your new skills that you have. You have the links to the instructional exercise videos. So literally how the exercises are performed and what you say to instruct those exercises for your patients. You've also got the links for the handouts that we use in our clinics. So you can download those, print them off, give them to your patients and use them. They work well, they help you get better compliance and better results with your patients doing those exercises. I'm going to give you literally a specific roadmap to walk you through the exercises. What exercises to do, when to do them, and how to instruct your clients and your patients on those exercises. The crucial thing here, though, is the physiology of soft tissue rehabilitation. Now, if you've purchased the mastery module on the exercise plan for plantar heel pain, you know that we dive deeply into the exact physiology of what happens with collagenous tissues and why we need to work in a certain way to get the best clinical outcomes. If you haven't got the mastery module, then in a nutshell it goes like this. You need to go through 3 phases. The first phase is about stretching the tissues that need to be rehabilitated. The second phase is about strengthening those tissues, and then the third phase is stabilizing. So you have to go through 3 phases: stretch, strengthen, and stabilize in that order. If you don't get it right in that order, then what will happen is your risk of not getting the optimum results or results that don't work out as you really want them to work out, then that risk of a less successful result increases. So the roadmap that I'm going to get you to follow, if you're seeing your patients once per week or twice per week, depending on their needs, that's fine, it doesn't matter. You're going to be giving just one exercise on a weekly basis. Now, the reason for that, the 3 key advantages in giving your exercises, just prescribing your exercises once per week. The first one is that it increases your rate of compliance. If you tell your patients just to do one thing at a time, it's easy for them to absorb and your compliance rate goes up. So that's a good thing. The second is it helps enables them to master the exercise. They're not trying to work out how to do 3 different exercises all in one hit. It's just one exercise at a time. It facilitates their mastery. The third advantage is that the timing on a weekly basis works with nature and its rehabilitation process of collagenous tissues. So putting all those 3 together, that's why just one exercise on a weekly basis. Now, this exercise plan is what we use in our clinics for 90% of the cases that we see, which are musculoskeletal compensations for the biomechanical excessive pronation patterns that are happening at the subtalar and mid-tarsal joint. So it's the vast majority of people who get this exact exercise plan. You can use it too for your patients. It goes like this. Week 1, the first of the stretching exercises. And what we use is the tennis ball massage to help release the intrinsic tissues through the soles of the foot. Week 2, we begin with a calf stretch or arch stretch. It's actually a combination. It's a calf stretch that includes an arch stretch. And again, to get some stretching effect of the intrinsic muscles of the foot as well as the extrinsic muscles of the foot. In week 3, we start ramping things up a bit because we introduce the dowel massage. So this is a fairly intense and fairly specific releasing, stretching routine that happens through the sole of the foot, working on the intrinsic muscles of the foot. When it comes to week 4, now you're going to begin the first of the strengthening exercises. Now, we incorporate 2 exercises here because they're pretty simple. The first one is the heel raise, and then the second one is the toe scrunch. And you alternate between the 2, so it's very easy to incorporate them into one routine. Week 5, if you need to do further strengthening, the Rathliff strengthening routine is an excellent one to really get into some strengthening work of both intrinsic and extrinsic muscles of the foot. Then you get to week 6, and now we begin the first of the stabilizing exercises. So simple stabilizing exercises are the balance exercises, and you need to adjust the balancing exercise so that it's challenging for your patient and where they're at. A 70-year-old retiree is probably going to find the balancing level 1, just balancing on one leg, reasonably challenging, whereas a teenage gymnast will probably find that not challenging. You might need to start at level 2 or level 3. But that's where your skill as a practitioner, you'll have to work out what's going to be challenging for that patient to master and get benefit out of that exercise. So that's the routine that runs through the 6-week cycle. If you have any questions or are not sure about anything, please don't hesitate to contact me. I'll help you out wherever I can. Until next time, serve with spirit, consult with care, and help the health of humanity today.